A health alert this morning. Memphis cancer patients now have access to a new medical breakthrough that's making treatment for some easier than ever.
And it all starts with a little bit of radioactive material placed inside the body. It sounds a bit strange that that's a good thing, but Dr. Alyssa Throckmorton with Baptist can explain why it is. This is working really well, but it does sound, you know, you hear radiation
Sure.
and you think,
It absolutely sounds a little strange. These are basically little tiny radioactive seeds or markers. They're a little bit bigger than the biopsy markers we use when a woman has a needle biopsy.
Okay.
They're used very routinely in prostate cancer treatment, but they're using 50 or 60 of them for that, and we're using 1 or 2.
Okay.
It's radioactive in the sense it emits some energy that we can then use in the operating room, a little kind of handheld Geiger counter to find. If you leave one seed in, and they can be placed before surgery.
Okay.
And in the United States, we use them no more than 5 days ahead of time because that 5-day period would be the equivalent of the radiation you get with a single mammogram.
Oh, okay.
So people
it's
feel
very
like that's
low.
kind of a low acceptable amount.
Okay.
This sounds like a pretty major breakthrough. Is this for all patients or just early stages, or when?
Well, we use it anytime we've got something in the breast that needs to be removed and you can't feel it. So we've used it for benign patients who are having surgery that have something that needs to be removed, or our early stage breast cancer patients that are having breast conserving surgery. We've used it occasionally for a lymph node in the axilla that needs to be removed. And it's not totally new because there's some large major academic centers that have been doing it for a while, like Mayo Clinic, MD Anderson, but our program's the first one in the Mid-South using it, and we're only the second in the state of Tennessee.
And there's some tremendous benefits to the patient, too, from what you've heard from those who have had it. I mean, obviously, it guides you so that it makes it easier to find the thing you're trying to get out, but how does it help the patients?
So for the patients, as opposed to using a wire, which is what we've historically used, for the patients, it's a lot more comfortable because they're just putting in a little tiny marker. They don't have anything hanging out on the outside. It can't really move. On the surgeon's end, it sometimes limits the amount of normal tissue that we might take out, because sometimes in a large breast, if you're having to follow this wire along its path, you may disrupt more tissue than what you necessarily need to for treatment.
Gotcha.
Following the procedure, though, what about recovery?
Recovery is basically the same as it is with that type of surgery without the seed.
Okay, and you do take same-day surgery, right?
Usually.
You do take out the seed, right?
Correct. We take out the seed, and there's a bunch of there's kind of a safety protocol per se that we follow to make sure that that seed's tracked and ends up in the correct place to be sent actually back to the company for the radioactive material to decay.
Wow.
Oh, wow.
Do you think this has wide-scale applications here? Can it be potentially used in other areas, you hope, or?
You know, we're using it, I think, for most of the reasons a breast surgeon would use it. I don't know if there would be some other applications in cancer where we're using chemotherapy, for example, before surgery. I mean, we've used it in that scenario. I don't know if it would apply to other cancer sites, but I think right now, for the most part, it's being used just in breast for this type of indication.
But it's pretty exciting to you.
Thank you very much.
Sure.
Glad to have you.
Thanks.
Thank you.